So brain spotting was developed by a gentleman named David Grand. He's in New York, and he says where you look affects how you feel. David Grand wrote one or two books on EMDR, but what he was finding was EMDR is too activating for some people. You know, this moving of the fingers of the light bar, it's too much. Like, what is brain spotting? Okay, so if you ask me right now, hey, where's a good place near here to get a sandwich? There's a good chance I would go, and I'm looking, and he calls that a brain spot or an access spot. And how it works is with sort of a fixation and a mindfulness. So we have a tool in brain spotting, and the tool is a pointer. So as you can see, I have a pointer here. So we'll quickly make something up. Let's say you're at the market, and someone drops a glass bottle of milk, and it shatters. Okay? And I would say to the person, okay, do you notice any activation in your body around that? And the person might say, yeah, I feel some activation in my chest, my heart is racing. Okay, great. And then similar to EMDR, where we ask someone between 0 and 10, how disturbing is this now? We do that also in brain spotting. And let's say the person said, it's a 4. Great. What we do is we find a spot that matches the activation inside. This sounds really strange, but it works. So I'll say to somebody, okay, so this person dropped this bottle. Does it feel like it's over on this side, or does it feel like it's over on this side? And what's really strange is, oh, you know what, it's over there. And we fine tune it. There's something called inside window and outside window. People have a tell, kind of like in cards. So I can actually see, like if I'm moving the pointer and someone starts blinking or there's a swallow, that's a tell. I know I'm on some information. Or inside windows, they know when they hit it. So they'll say, yeah, stop right there, right there. And then, you know, we test it a little. Is it a little bit better or worse as we come up, or a little better or worse as we bring it down? And we actually stay on a specific spot. So as the client is looking at that spot, I'm in attunement, absolutely looking at them. And we bring in the somatic things. So it can be, what do you notice in your body as that memory comes up? And it's different for different people, but it's images, it's memories, it's emotions, it's sensations. The material comes up. Really interesting, different than EMDR, but similar. And some of the same techniques that we use in EMDR, we can use in brain spotting. But it's this fixed sort of mindfulness and with the pointer. And so David Grand posits that this gets to the nonverbal, non-cognitive areas of the brain, which it does seem to do. And in therapy, by the way, it's a little bit less talking. So the person is staring at the pointer, and then I might check in with them. What's happening for you now? It unfolds. Or sometimes they report a lot, but it's a little different experience. So I wanted to be sure today to tell you about brain spotting.